Okay, on average in the United States, a family has to spend around $16,000 to deliver a baby vaginally. However, if there's any complications and they have to be delivered via C-section, that's around $29,000. When my mom was pregnant with my younger brother, he was an emergency C-section, and he had a long stay at the NICU. He was there for 49 days, and due to the needing extensive care and the emergency C-section, it was $181,000. Ridiculous. America has the highest costs of healthcare in the world, resulting in less people getting the help that they need. Today, I want to talk about why healthcare prices in America need to be lowered because people simply cannot afford the help that they need, and insurance does not cover everything. Today, we will explore the problems and then look at potential solutions. With that being said, in America, healthcare is unaffordable for most families. Healthcare costs in the United States are prohibitively expensive for many families. Families often go into debt for medical expenses, leading to financial instability. High costs deter individuals from seeking preventative care, resulting in more severe health issues down the line. Many people are uninsured or underinsured, creating a significant barrier to access necessary health care. Approximately 30 million Americans lack health insurance, leaving them vulnerable in emergencies. Insurance policies often come with high deductibles and out-of-pocket costs for families that they simply cannot afford, leaving many without the coverage that is essential for the treatments. The burden of medical debt is often overwhelming and is one of the leading causes of bankruptcy in the United States. Millions of Americans face stress of debt collectors and damaged credit scores due to unpaid medical bills. The impact of these high costs is profoundly harmful, leading to serious consequences for individuals and families alike. High healthcare costs exacerbate existing health disparities in marginalized communities. Communities of color and low-income families experience high rates of chronic illnesses due to inadequate access to affordable care. These disparities lead to higher mortality rates and poorer health outcomes among vulnerable populations. Mental health services are often overlooked to affordability issues. Many face barriers to obtaining mental health care as therapy and medications can be prohibitively expensive. The lack of mental health resources can lead to devastating consequences, including increased rates of suicide and homelessness. An overall lack of preventative care can lead to increased long-term costs for society. When individuals delay care due to costs, minor health issues can develop into severe complications. Emergency care is far more expensive than maintaining a routine health visit, which can strain on the healthcare system. Addressing these challenges is crucial to improving the state of healthcare in America. Implementing a single-payer healthcare system can significantly reduce costs. Countries that have single-payer systems spend less per capita on healthcare while achieving better health outcomes. A single-payer system would eliminate administrative costs associated with multiple insurance providers. Expanding Medicaid and Medicare could provide necessary coverage for millions in the United States. Lowering the eligibility rate for Medicare could allow more individuals to access healthcare services. States that have expanded their Medicaid report improved health outcomes and reduced underinsured rates. Investing in preventative care and community health can reduce long-term costs. Programs focused on prevention can lead to healthier populations and reduced healthcare expenses. Supporting community health resources ensure that individuals have access to necessary costs at little to no cost. At little to no cost. In order to create a more equitable healthcare system, it is crucial we consider and implement these solutions. In summary, Healthcare in the United States is unaffordable for many, leading to significant health disparities, overwhelming medical debt, and avoidance of necessary care. It is imperative that we strive to lower healthcare costs and explore solutions to ensure everyone has access to quality care, regardless of their financial situations. Together, we can advocate for a healthier future for all.